Dr. Crockett and Dr. Crocker here with Zeal Integrated Health, and we're going to talk about the 4 types of diabetes today. A lot of people know about type 1 and type 2. Type 1 is usually early onset, usually developed as a child, and usually put on insulin immediately to deal with it. So these are things that are typically managed early on in someone's life. Type 2 usually is a later onset, but there's lots of mechanisms that can cause type 2 diabetes, and so there's a lot of things that have to be assessed as to what's driving that disease. And we typically talk about those 10 things in our webinars that we put on, but there's a couple other types that are out there that people don't know about. And so, Dr. Crocker, tell me a little bit about what's called type 1.5.
Well, type 1.5, I'm sure a lot of you have not heard about this type of diabetes. It's more of an autoimmune condition, really where it happens later in life. It's something a lot of times people develop as they go along. So it's not something that you were born with. It's more of something that your body has just kind of turned on itself and starts attacking your. A lot of times what we find is the type of food that we're eating nowadays has kind of turned our immune system into more of attacking our body, attacking our situation, and then it causes you to have more issues with insulin, causes you to have an issue with the pancreas not producing insulin. And a lot of times these people are the type of people that come in and they might only weigh 140, 150 pounds. Their blood sugars are 600, and we have to actually have them gain weight. We have to actually have them not exercise as much because it can cause more of an issue. The other one's going to be more of a type 3 diabetes, which we call Alzheimer's, and so that's more of something that I'll have you kind of discuss there.
Yeah, so type 3 is something that's kind of come out in the research lately, and it's related to Alzheimer's. 65% of type 2 diabetics will actually develop Alzheimer's, and they say Alzheimer patients 100% of them have troubles with sugar processing in the brain. So they've kind of classified this as a type 3 or a third condition where we start seeing diabetic issues in somebody that's dealing with a cognitive decline issue like Alzheimer's. So there's multiple things that this disease pushes. It can obviously cause a lot of cardiovascular damage throughout the systems and affect the eyes, the kidneys, the heart, and a lot of all those tissues through blood vessel damage. But we see it also impact the brain and lead to type 3 diabetes as well.
On that note, all of these can be worked on, they can be helped, they can be treated. So it's not something that you see one not get treated and the other ones you can, but you can work on all of them.
Yep. Thank you.